Senator from Orangeburg, Senator Stevens, what purpose do you rise, sir?
President, the senator yield for just a question on burning.
Senator yields for a question.
And Senator, you know that I too, as my colleague from Charleston, I did not smoke marijuana while I was in college. But Senator, the contact high that is contributed to the burning of marijuana, and you spoke about vaping cannabis. Is there any effect from the vapor of cannabis? Do you know of?
Not that I know of, but let me get you a more precise answer on that. What I will say is that the bill does not allow even the vaping of it to be done in public. So I don't think it has the secondhand smoke. In fact, I'm pretty sure it doesn't, that burning leaf would have. But in any event, the bill is structured in such a way that you cannot do it in public where you'd be around other people. So it's not like smoking in a subway or a bus or something like that. I mean, you couldn't do that.
And one last question, Senator. And do you know the many different strands of cannabis, and to what degree that it is effective for arthritis, for osteoarthritis? I saw look like about 10 different strains, or 10 different things that it can actually help and is therapeutic for. But Senator, I guess a physician would know what variety that he or she will prescribe for one of his or her patients. As I look at some of those names like Orange, Mesic, or whatever, and you know its ratio of THC and others. Do we really know, or we feel secure that what is prescribed for a particular patient is actually what he or she needs?
That's a great question, and I think it's one of the reasons why there's been this concern about involving pharmacists in the dispensing process, because you know each one of these cannabis products in this statute has to be labeled in terms of what percent THC, what percent CBD, and I think that there's enough evidence out there to where how most people generally respond. You can say, okay, these ratios may be good for those with MS. These ratios may be good with people with Crohn's disease. These ratios may be best for people with epilepsy. These strains. So there are some general points of departure there. But again, I would say what I said yesterday is every individual's endocannabinoidal system, what we're made up of, is different. And so what might be effective for one person in terms of the ratios might not be effective for another. And so I think that highlights what the senator from Charleston, Senator Campson, was saying yesterday is we need to focus on trying to get the skill set of pharmacists down at that level, and so that the pharmacist can then consult with that patient and talk about those ratios and talk about those ranges, get the feedback from the patient on whether or not it's addressing the underlying condition, because and really I guess all medications are somewhat like that. Nobody responds to a certain medication precisely as another person does. But I think that that's particularly important in regard to cannabis, because everybody's endocannabinoidal system is different.
And do you know, Senator, after your presentation on yesterday, and specifically the one that denotes the general populace and their feelings about medical marijuana, when I got back to my office, there was something like 9 emails that popped up where folks were thanking you and thanking others for speaking in favor of cannabis. And one lady I remember in particular, she talked about the many seizures that her child had over the years. And she went all as far as Florida to try to get that child help. And when the child was given the opportunity to be given medical marijuana, it was a total change in the health of that individual. So there are individuals out there, sir, who are actually feeling good, feeling better now about the care for their family members, that there is something in the horizon that will make their lives a little brighter.
And Senator, what I would say too is as this bill has moved over the last several years, there are a lot of anecdotal experiences and real-world testimonials like that from patients, and they're extraordinarily moving. And we heard a lot of those testimonials given at our subcommittee hearings. But did you know? Well, I'm going to say it, so you will know it. That in addition to those anecdotal stories, which are legion, we now have peer-reviewed medical studies, okay, that have reached conclusions documenting how cannabis can be effective in redressing certain medical conditions. And the 13 conditions that it's a very narrow set that's in this bill. What I have and what I alluded to yesterday was the various peer-reviewed empirical studies that establish its efficacy. So it's not just anecdotal, because that's a lot of times early on in debating this bill, what I'd hear back from opponents would be, oh, that's just anecdotal evidence. Those are stories. Well, first of all, you can't be dismissive of somebody's personal experience. You should never be dismissive of somebody's individual experience. But second to that, though, we do now have a body of peer-reviewed medical science that does show and explain why medical cannabis can be effective in addressing this condition. So it's not just the emails you get in the stories, it's also the studies that are published in journals like, Journal of American Medicine and National Institute of Health. And I mean, so this isn't some outlier thing. This is real. And the fact that it's real is underscored by the fact that you've got 37 states that have authorized doctors to do this now. If that weren't the case, if it weren't the case that it actually provided relief, you wouldn't be seeing that.
And Senator, do you know, and I'm referring back to a comment made on yesterday concerning the blood content level of alcohol during an arrest, and the amount of marijuana consumed and its tendency to remain in the bloodstream over a period of days or maybe even weeks. So do we truly know, Senator, that the contributing factor to an accident was not solely because of the marijuana that was still showing up in the bloodstream, or it was all alcohol?
Yeah, I frankly admit that at this point in time, we don't have a way to measure meaningfully THC content in a body and then to infer from that that's what caused this accident. Now, it's not like the blood alcohol content, the BAC for drunk driving with alcohol. So you are going to, law enforcement is going to have to, in incidences where somebody is driving under the influence of cannabis, the field tests that are conducted, and conducted now in many instances, that's going to be the predictive thing in regard to whether there's probable cause to arrest somebody. But I would point out that's also the case if somebody is driving under the influence of opiates or opioids or things of that nature. I mean, you can't meaningfully do a blood alcohol content level test in that regard either. So if you're going to say, you can't put that forward as an argument for not legalizing medical cannabis unless you're prepared to outlaw a whole lot of other medicines that you can't properly assess at the time somebody's driving under the influence.
Thank you, Mr. President. Thank you, Senator from Beaufort.
Thank you.